From a quality standpoint, absolutely. It has improved our quality, our engagement, the overall scope of how we look at that continuum of care, not just the patient itself, but the quality, the services, everything that continuum throughout their entire stay.
I have access to my Access providers on a daily basis, and their documentation is what helps us to get days covered, because usually everyone thinks that the insurance company is just going to give us just 7 days off top so they can have inpatient stay care, but that doesn't happen. We may get 2-3 days, and then in 3 more days, we have to then talk again to the reviewer, and we have to let them know, okay, so our doc wants to do this, this, and this. Our providers definitely do a very good job on a daily basis of letting us know, like in documentation, why this patient needs to continue to be here.
They are a part of all of the admission process. They are part of all of the discharge process. So in the past, you waited for, say, treatment team or for the provider to show up, and then they get just this blob of information. They're a part of it real time. As the team is working through it, they're a part of that conversation. They're a part of the interactions. They're helping from admission all the way to discharge. The providers are able to remote in at any time, go in, review the notes, work with the team, make those calls, talk to the nursing staff. So everything really happens real time instead of having to wait for them to come back into the office. We have not only a psychiatrist that is a medical director, but we also have a number of psychiatric nurse practitioners that are part of the team that are actively involved. And so you have the psychiatric nurse practitioner partnering up with our registered nurses, our LPNs, our techs that are on the floor, utilization management, a part of building our electronic medical record and providing that guidance and feedback and helping even the backdoor paperwork, things that have to happen to take care of the patients. They're involved with that as well.
It is very easy to communicate with anybody with Access, from scheduling or even just talking with the providers. They're willing to explain their reasons behind this. If I bring up any issues in charting or anything like that, they're very responsive and they're willing to correct it, and they're willing to do anything to help this collaboration improve.
They're always available and they're always open to talking to me. I can always call them. They answer the phone even if they're not on call that day. They like to hear our opinion. They teach us different things. They let us know why we're doing this a certain way. It's been nice having that medical director focused on quality that gets to participate in our medical exec board, that attends our quality meetings and performance improvement meetings. It's not just seeing patients and then they're out the door. There's also the healthcare related issues that we have to face day in and day out. Looking at ways to reduce falls. Are we looking at ways to reduce violent outbursts? What medication adjustments can we look at that will help the patient for longer so they're not having readmissions and not having to come back into the hospital quite so frequently? And so the whole gambit of care. It's been a great partnership for every piece.